So it helps me quite a bit, but I reinforce it with movement, stretches, exercises, and we believe in that. And relax your shoulders for me, a little tighter here, okay? Good. Hey Baltimore, this is Dr. Warren Kalkstein here at Kalkstein Chiropractic. I wanted to introduce you to Mavette. Mavette, you've been coming to see us for the last few months. So we see a lot of different problems in the area. She goes to Morgan State. She's a business student there. Brought her car down from Connecticut, and she got in a car accident. Got hit, actually. And you were already coming in here to see us prior to the car accident, correct? Mm-hmm. Right now I'm just doing some passive soft tissue work. I'm showing you what she normally gets in the office for her, the care with her neck. You kind of just overheard. She's getting kind of progressed and promoted to a little bit of a different routine. More on the exercise floor, working with our personal trainers, because she wants to kind of take that next step and not just feel better, but functionally really improve her dynamic, her ability to move and be strong in that area. So this is what she was getting and what she's getting today. In the future, she gets a little less of me, a little less of the next thing, which is the dry needling, and then we'll get after it. But I'm so grateful to get to work with her because I think she's, you can kind of tell she's been an advocate for her personal health, and she handles it, I think, in a logical way. And so you came down to Morgan State. Mm-hmm. What made you want to come to school down here?
I think I was looking for an HBCU, mm-hmm. and Morgan is one of the closest ones from where I'm from, and
really?
It's also the most known one.
And there's not as many in the Northeast?
Yeah, there's none really. Just
wow.
Pennsylvania.
What school in Pennsylvania is an HBSU?
Lincoln.
Okay, gotcha.
And I think there's one more, but I can't remember that one.
Didn't Lincoln just win the basketball tournament?
I don't.
You know which one I'm talking
sure.
about?
Mm-mm.
So they host, basically those colleges have a tournament. I think it's called the CIA. I might be butchering that, but either way, they play in Baltimore every year, and it's a really awesome tournament. There's 32 teams, 32 historically black colleges that come down and compete. And I think it's us and Charlotte host it every year. Oh. Every other year.
I never heard of it.
Oh yeah, for sure. It's a great. I think one of our interns that's from Towson, her mom went to school and must have played basketball because Asia's a basketball player too. So they went and they said it was an awesome time. But yeah, so you wanted to come down and experience the school and get education. You kind of already know what you want to do, though.
Yeah.
What do you want to do?
I want to be a hair salon owner and a hairstylist.
Nice, that's awesome. And you already plan on either Paul Mitchell or go to the school here in Baltimore, correct?
Mm-hmm. Yeah. I've toured them both.
You made up your mind?
No. It depends on if I decide to stay in Baltimore or go back home.
I got you. Turn your head to the right. Good. You're going to feel a little bit more of a stretch. So we're just doing the rotation from side to side. We're stretching out some of these muscles in the neck. She's got a little bit of a tight point right here I'm going to get to in just a second. You're moving well, though. You'll have an easy adjustment going from the left to the right. Relax your head. You'll feel pressure. Good. Loosen your neck and shoulders. Good. And this side's a little tighter, okay? All right, turn your head to your right. And relax. Good. Let your head rock back. Now just get like kind of lazy for me. There you go. There it is. Good. Awesome. I gotcha. Here you go.
Thank you.
Yeah, we're gonna do just your upper back now. Okay, so come face down for me. There you go. Take a deep breath. Easy exhale. Good. All right. Relax this left shoulder. Good. And really kind of almost think about your chest just falling to the table. There you go. Mavette. Perfect. Good. A little light release right here. Good. Go ahead and turn your head to your right for me as far as you can comfortably go. Rotation to the right is full, to the left for me. And then I'm just going to challenge it a little bit. Left is limited by about 10 degrees. Go ahead and face me. Bring your head back. I'm going to bring you back farther. Bring your chest up to the ceiling a little bit. There you go. 2 fingers in extension. Rotate you. Let me know if there's any discomfort or pain in your neck. I know.
Not in my neck, but I honestly get a little bit of tingling down both my arms.
When you go back like this?
Yeah.
Gotcha.
More so when you're also like turning it and I'm back.
So that rotation with compression causes some of it in both hands equally or in the side that I'm going?
Right now it's worse than the left.
When I pull it this way?
Yeah.
And then when I come here?
Worse than the right.
Good.
And I feel it more so like go through
Positive shoulder
my thumb.
decompression on the left hand side. Scalene's plus on the left. Then come over, arms up for me. Go up to the ceiling nice and slow. Good. Do that again for me with your elbows straight and no bend in them. Good. Go ahead. Good. Shoulder flexion is full. Good. And relax. You can go ahead and face me like this way. And then
Wait, what?
Do one.
Face you this
Face
way?
me. Yeah,
Okay.
like that. That way we got space.
take
We
my
got a
watch
little tight space. Just get up against the wall. Arms out to the side, thumbs up, and just go abduction above your head for me as high as you can comfortably go. Nice. Good. And then come back down. You feel a little guarding at the top there, but overall that looks really good. Take a seat right here for me, Sarah. Good. Arms like this. Good. Bring your arms forward
I
a
would
little
say
bit.
even just doing that, I feel tingling
Like
in
a
that
shoulder
area.
range of motion. Yeah. Just a little tighter in that area. Shoulder range of motion is full inflection and abduction. Hold strong here for me. Good. Arms like this. I'm going to pull. Hold strong. Good. I'm going to push. Hold strong. Good. I'm going to pull. Hold strong. Good. I'm going to push. We're back on myotones for cervical spine. She's 5+ in the deltoid. Good. Wrist back like this. 5+ tricep, bicep. Hold strong. Good. And hold. Good. And foot. So we're checking all these things. She had some weakness in her deltoid and tricep when we looked at this in the past, but it looks really good. The biggest thing, as you're kind of hearing from Sarah right now, that I'm going to look at is some of the numbness and tingling, which can happen for a lot of different reasons. Fingers like this. Hold strong here for me. There you go. Good. So finger flexors are 5+. Wrist and extension and flexion is 5+. Hands like this. Good. Squeeze your fingers together. Good, and relax. Good. T1, 5+. Look at me. Does that feel about the same?
Mm-hmm.
Good. Does that feel about the same?
Mm-hmm.
Good. Does that feel about the same? Good. Look at me. It's all good. It just helps. This is what they taught us in class. I don't know how much of a difference that makes.
I do with my patients too, but I don't know why I look down.
Does that feel about the same?
Yeah.
Good, and you can relax. Good, shit, get on out. When you get that numbness tingling, does it happen often, like when you're in bed, like in a certain position at all, when you're reading on the phone, anything like that?
I find like if I'm rather like resting towards like the side, or if I have my arm above my head in any kind of way.
Yeah. Then you get it. So in like kind of positions that your shoulders, maybe we'll call it like you're putting a lot of pressure on your shoulder in different angles.
Yeah.
You'll get it, but like day to day, you're not like having to shake your hand out or anything like that when you're
Not
working.
just regularly, but there'll be times like I'll even be like at work just charting, and even just like doing this, like it'll happen.
Start to occur. Okay. Go ahead and relax here for me. Good. And then take your right ear to your right shoulder. Good. And turn it a little bit. Good. And then bring it back. Good. Awesome. Okay. So just looking at like, obviously there's some cardiovascular components that can play a role into that. I don't think that's the case at all. Go ahead and stand up for me. General tension over time, as well as compression. Ischemia is the kind of the buzzword in the in the concept of pathology around a nerve. Lie on your back for me. So pressure on the nerve. It can come from a lot of different areas. So, but you can go a little bit farther in terms of function of that nerve and how it travels. So tension again affects that and how it slides and when it gets compressed. When you're a little tight, a little irritated, you're typing for a long period of time. it puts compression around it. Oxygen can't get to it as well as it could, to all those small little blood fibers. Excuse me. To all the oxygen can't get to those areas, so you kind of pinch off the blood supply to the tissue. And so at the end of the day, when it comes to nerve compression, you focus on mobility routines, strengthening, avoiding areas where you're aggravating it. Okay, so let's keep after it in the gym. Be mindful while you're working. Don't worry about this. This is part of the deal of you're getting your shoulder healthy again.
Okay.
Okay. And so I'll look at some of that neurodynamic components of your shoulder here. So I'm going to come out. Let me know if at any point you start to get numbness, tingling.
Right now.
Yeah. Okay. And so positive median nerve tension sign.
Right now.
Radio nerve positive. Good. Relax. You already getting it?
Yeah.
Take your left ear to your left shoulder. Same, but or worse?
Worse.
Okay, go away. Tell me when.
Right there.
Take your left ear to your left shoulder. Same, better, worse.
No, the same.
Take it back to the center. Take your right ear to your right shoulder. Same.
Oh,
better.
that got worse.
Okay. You can square up towards me, scoot to the edge just a little bit, and then sit up nice and tall for me. I want to see you turn your head to your right. Now, I am keeping in mind that she had a little spill at the beach. Turn your head to your left for me. So, all things considered, there's a little guarding in her shoulders.
Yeah.
It might be because she spilled over a huge group of rocks trying to chase after her son in the beach. But, we'll take that into account as we're moving her. Good. Bring your chin down to your chest. You do feel just a little tighter through your bilateral trap. Go back all the way for me. So with range of motion, I can check the joints passively by putting compression down on them at the end range. Bring your chin to your chest for me. Very easy. Good. As well as the muscles. And I'm just seeing how she's guarding, if there's any irritation to the joints. Just a little bit more guarding through there. I can just feel it pick up already. Right. And then in Nikki's case, she had a lot of shoulder pain as well, and she had some pain referred down her arm. So I'm going to make sure that the muscles, from a myotome standpoint, or that the nerves aren't agitated anymore. So arms like this for me. Good. I'm going to push down. I want you to hold strong for me. You tweak that right shoulder a little bit. Arms like this for me. Hold. Good. Hold. Good. Hold. So creating tension and then muscle strength, and I'm just seeing how it's giving underneath my pressure. And hold. Do this side again. There you go. Good. Wrist back like this, like you're a motorcycle. Good. Each of these correlate with different levels of the neck, right? Relative to the levels that we check, C5, C6, C7, T1. Flip. In whiplash cases, you'll find weakness like this in the beginning due to nerve root irritation or inflammation in the neck from that motion that the neck goes through a car accident. Hold strong. Good. And with conservative care, usually it responds really well. We don't normally need to refer out. We can if we need to for any type of dose packs, epidurals, trigger point injections, things like that. Honestly, just supporting the body as it's going through its healing process is what we need to do. Hands like this. Hold strong for me. Good. Strong. Good. Squeeze your fingers together. Good. Take this. Now I'm going to check your wrist a little bit on that side. That looks good. Good. Relax for me. Good. No numbness and tingling, no sensory changes, so I don't need to do any sensory loss tests in the hand. No upper motor neuron tests. Her reflexes are good after the accident itself. I don't need to check her tricep, brachioradialis, or bicep reflexes that addressed, again, different levels of the cervical spine. She had some positive tests for, it's called de Quervain syndrome, or tenosynovitis of the extensor hallucis brevis and longus muscles in this area. And so I'm going to do a little testing on that. Thumb comes down here and here. I'm just going to load it and see how she's feeling. She could barely She could really barely
it's
80
stuck,
duck
yeah.
her first digit before. It was felt stuck through the joint and through these tissues, but she's moving a lot better through it. I'm still going to treat it a little bit today relative to some soft tissue work.
Okay.
But from the accident itself, a lot of the things that I saw early on are coming along really well. Reach your arms above your head for me, nice and easy. Shoulder flexion's good. Again, you're a little limited on that right side.
That's the side
rock.
that took the spill.
Did it? Yeah,
Yeah.
Bring your hands above your head. Easy. Good. Good. Okay. And then bring your arm like you're holding a shield in front of you. It's called Hawkins-Kennedy's impingement test. Hold strong for me. It's awesome. Good. Modified empty can. You're going to bring your hand like this. Thumb down. Relax your shoulder for me. Good. Bring your hand up. So here is a shoulder-focused exam now. Hold strong. Everything else was cervical spine and hand and wrist. Good. Feels good to me. We're going to bring your arm up here. This tests the lower side of the rotator cuffs, infraspinatus and teres minor. Pull your wrist back for me. Hold strong. Good. I'm going to push. Don't let me move you. Come on, come on, come on, come on. There you go. Good. Strong. You let me know if there's any pain with that too, Nikki, okay? So we're going to do a group of cuff challenges here. We're going to look at external rotation in this position. This is going to be more supraspinatus in nature. Hold strong. Good. And then push in, internal rotation, subscapularis. Good. And then again, this is the same thing as a modified empty can, but it's both sides so I can compare. Relax that right shoulder if you can. There you go. Hold strong. So she's got a little guarding on that right side. I don't need to challenge that side too much or it would hurt. So I know I'm after this is all settled and done, we'll focus on this new injury.
Okay.
Striking them up a little bit.
I know.
That's what happens when you have kids, honestly.
Yeah.
All right, so we looked at the neck, we looked at the range of motion, did passive range of motion, addressed the joints by putting compression on them, okay? We looked at muscle strength, sensory, we didn't need to do, and the upper extremity to, again, look at the neck. Reflexes are good from the start. Range of motion and the shoulders. Inflection and abduction is something that I look at. To do abduction out to the side like this. Hands go above your head. Good. And come back down for me. Good. Really clean, actually, on both sides. And then we did some specific joint testing, structural testing in the shoulder to see if any of those findings came up. We looked at the wrist. We did a Finkelstein test. Some guy named Finkelstein. Just stresses that compartment. Range of motion, the wrist, palpation, joint palpation as well. And everything feeling pretty good. All right, we're going to do some laser on the hand. I'm going to adjust her mid-back and upper back. And then we're going to release her from care for the accident. Cool. We'll send all your records over. That'll be taken care of. They'll communicate with you, and then they'll do their things, however that works. Go ahead and stand up for me. I'm going to bring the table up, make your life a little easier.
Okay.
There you go. And you can come on in and relax. Good. Awesome. There you go. The kids in camp?
Yeah.
Nice.
Yeah, they had an early morning meeting this morning.
Yeah, my middle is too young to be in camp. My oldest is too young to be in camp. So it's kind of in this in between land of when we can't really drop them off anywhere during the summertime. So
Yeah, mine have to be there at 8 a.m. I'm like, oh.
It's early, yeah. They're longer days. I mean, for sure. But it's nice to give you a little break during the day. Take a deep breath in and relax here. Look forward a little bit for me, Nikki. So a gentle mid-back TL junction adjustment. Good. Good. She's moving really well. Good, loose. Now we combine chiropractic and physical therapy, rehab, fitness within this office. There's more to health than getting adjusted, in my opinion. It's just a catalyst. It's a mover. It takes care of pain really well. Lie on your side, this side up. I get adjusted regularly. I love it. It helps me, especially when I'm all locked up from trying to tube with kids half my age that kill me over the weekend. So it helps me quite a bit, but I reinforce it with movement, stretches, exercises, and we believe in that. We practice it and apply it to our patients too. Come on your side, face this direction. So we have 4 personal trainers out there putting people through some moves, exercises, as well as putting people through just whole body programs. relax your shoulders for me. A little tighter here, okay? Good. Okay, come on your back. Scooch down a little bit towards this way. That's perfect. Good. And relax. Turn your head to your right for me, Nikki. Good. Rest your hand here. Hold on gently. Take a deep breath in. Easy exhale, loose. Perfect. Nice. Good, now rest. Okay, I'm actually going to sit you in the chair. You got a little suboccipital tension there.
Okay.
Alright, and then turn your head to your left. Good. To your right. Good. So, motion palpation in the cervical spine, occiput restricted on the right hand side. This is how I adjust it. Turn your head to your left. Good. Rest your shoulders. Good. I got you. Let your head fall. There's your spot, yeah? Mm-hmm. All right, let your chest fall back. Good. Relax your jaw. Good. Breathe in. Exhale, let it go. Good. Settle your body. Good. Ooh. A little lower and a little easier. You're going to feel most of the movement again on that right hand side. Okay. All right, we'll rotate with me. Keep going, keep going, keep going. Good. Let me see your hand. How's that feel?
Good. I like that one.
Yeah, me too. I asked that. I knew that felt good, to be honest with you. You know what I'm saying? Good. But, you know, people watching, I'm like, what?
No, that felt really good.
Good. Take a deep breath. Easy. Relax your shoulder. Relax your hand. Good. Just easy pin and stretch over the base of that muscle so that I can adjust your hand a little easier. Good. Relax your arm. Good. So she's going to go get light therapy here. Okay. You got time, you can do your stretches. If not, you can do them at home. You know them. We give you picture sheets so that you can just keep doing them at home.
I've been following them from my pictures.
Yeah, nice. It helps. Mm-hmm. Yeah, and I get it. We got places to be. That might be that 10 minutes before we go to bed. That's the only time that we got time to stretch.
Immediately when I get home.
Gotcha.
Immediately when I go home and the boys are like, "Can I go outside?" Yes, you may.
There you go.
Do my stretches.
Nice. Mine's at 7 o'clock before the shift starts. I grab the foam roller and go out on the exercise floor. Mm-hmm. That's my usual. All right, a little release here. Good. Good, elbow feels fine. Mm-hmm. Cool, thanks for watching. If you need help, been in an accident, or if you just want to come get care by us, we have an awesome team here. Come by and see us. Thanks for watching.